1 o'clock, right on. Good afternoon. I'd like to call the Human Services meeting to order, and we will start with the pledge to the flag, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And can we have roll call, please?
Mrs. Burdick.
Here.
Mrs. Ricketts Swales. Here. Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mr. Healy.
Here.
Mrs. Root.
Here.
And Mr. Harris. 6 present.
Thank you. And I would entertain a motion to approve the minutes of January 15th, please.
Hanchett will move. Ricketts Swales will second.
Any corrections or changes? All in favor?
Aye.
Carried. And we will start today with Anita Madison from the Office of the Aging. Welcome, Anita. Tough parking out there?
Very much, and cold walk.
Yes.
So. Thank you. The first thing on the agenda is our monthly report. I have just a few things to highlight. Our health insurance, I know we've talked about it the last few months in a row. So if you look at this month, this is December's monthly report, so this is the end of open enrollment for this last year, which is only to December 7th. And our contacts were 639 versus the same time last year at 281. So if that, it's been kind of the theme for this year's high cap season and continues to be very busy with Medicare insurance counseling. And the other thing that I'd like to highlight is our home delivered meals. This time, this year, our total meals between home delivered, congregate, and go and dine were 9,173 meals for the month. Same time last year, 9,076. So for the end of the year, we had provided over 110,221 meals between congregate, home delivered, and go and dine meals to older adults in Allegheny County.
Good job.
Thank you.
That's a lot of people that are
Yeah.
being
Good program.
positively affected.
Thank you. The other thing I wanted to highlight is our Go Grandparent, which we have talked about a couple months in a row. And in December, we did 44 rides for the month of December through our Go Grandparent program. Just to give you kind of an insight in the increase in numbers for the month of February, and this is only the 19th, remember, we already have 47 rides scheduled just for the month of February, and we're only on the 19th. So we are primarily using this for transportation for older adults to medical appointments that are unmet in any other capacity, things like dialysis where insurance won't cover it, or out-of-county transports and there is no family, friends, or other supports.
That's fully funded,
That is state funds.
state funds?
Yes. They're allocated directly to Go Grandparent and then in our name, and then we use those funds directly from there.
Thank you.
Anita, what's the age on that?
Go Grandparent is 60 or over because
Okay.
it is a state fund through the Office for the Aging, the New York State Office for the Aging.
Perfect, thank you.
You're welcome. That's all I had to highlight on the monthly report.
All right, so we can go to, you want to accept and appropriate some money?
Yes,
From a federal
please.
grant?
So we're looking for a resolution to finalize some additional funds that we received underneath our MIPA funds. MIPA is the Medicare Improvements in Patients and Providers Act. So we had budgeted in our 2025 budget $16,384 when we actually received $22,159, and we'd like to allocate that into our 2025 budget. Underneath regular pay, retirement, VICA, mileage, phone, advertising, and it is an increase of $5,775.
Can we have a motion to accept that, please?
Root will make that motion.
Healy will second.
Any questions or comments? All in favor? Aye. And that's carried.
Thank you.
Okay, and the next one?
We're looking for a resolution to accept and appropriate $28,950 underneath our federal funds for our American Rescue Plan and $4,100 in client contribution underneath the same programs. The final funding administered through the Area Agency on Aging supports expenses to increase services offered including the COVID-19 vaccine assistance, home care, home delivered meals, and PERS. So we're looking to put it under contracts. our contractors, general supplies, office supplies, mileage, and fees.
Okay, can we have a motion for that one? Hanchett will move it. Ricketts Swales will second. Any questions? All in
This is-
favor? Whoop, go ahead, Mr. Yuli.
This is all money coming into the county, right? From
Yes.
outside sources. Thank you.
Any other questions? All in favor?
Aye.
And that's carried.
Thank you.
And then a request to fill.
Yep, the last thing on our agenda is just a request to fill one full-time aging service technician. This is to fill one of two aging service technicians' positions that were promoted, and so they vacated these positions. We're only looking to fill one of those at this time. This is a grade 13. It is 5% county, 95% state, and this is to do home-delivered meals assessments or in-home assessments that are required through the New York State Office for the Aging to receive our state and federal funds. It is also to help with New York Connects duties and some insurance counseling as well.
Okay, can we have a motion to accept, to fill that? Ricketts Swales will move it.
Barnes, second.
Any questions or comments? All in favor?
Aye.
And carried. Thank you, Anita.
Thank you.
I got a question.
Yes, Mr. Barnes.
I'm going to be asking everybody this question this morning. Does the DOGE program coming out of Washington, has that affected anything at your department at all?
No, not at this time.
Nothing as far as future grants or anything that?
We have not heard of anything. We've had some communication with the director of our New York State Office for the Aging, who monitors all of that, and at this point, we don't have any impact right now.
Thank you.
Yep.
Thank you, Anita. And I believe Tyler's on vacation, so we've got Jamie here today from the Office of Public Health Director, Deputy Public Health Director.
Good afternoon,
Welcome,
everyone.
Jamie.
Yes, he is on a well-deserved vacation.
Yes.
A lot to present today. As far as the monthly report goes, really not seeing many changes. I guess I would say the biggest thing is reproductive and sexual health. We are up quite a bit in STI investigations and just medical services overall in that program.
Those are tested at the clinic in Alfred and here?
Yes, yep, we do 2 Alfred clinics a month and 1 Belmont clinic a month.
All right.
Okay. First MOE is for the Health Department requesting a resolution for the approval of our agreement with Accurate Analytical Testing. They are a lab that does all of our testing for lead, soil, water testing, paint chips, drinking water.
Okay, can we have a motion to accept that?
We'll make that motion.
Hanchett will second. Any questions? How is the lead still numbers up? When-
Yes, the numbers still continue to increase, but we are able to close them out a little bit quicker than we used to. The state enacted a rule last year that if we're not getting cooperation with the parents, we can close them out if they're not a high-risk case. So we've done that on a few occasions. But having that extra person in environmental, that's where we get stalled. So that having that person through the grant has helped move that a lot quicker through the process.
And one other question on the lead, the contractor training. Have you had much acknowledgement from the contractors to take that training?
Yes, yes. The abatement training that is coming up in March, we had 16 openings for that class. All 16 spots were filled quite quickly.
Oh, good.
So we've been referring them to Cat County because that's all we budgeted for. And then the worker handler abatement class, last I knew, we had 4 people signed up out of the 16. Most people are going to take the supervisor because they can work and they can supervise, whereas a worker can't do both. So,
Okay, good.
So we were quite shocked with those numbers and that they filled up so quickly. But the advertisements, the billboards are where most of the people were seeing that information coming from.
Great, good to hear.
Yeah.
All right,
Question-
Ken. Yes.
question.
Yes, sir.
Primary cause of the lead problems, would that be aging infrastructure here, or would there be some other issue?
The 2 main things are the aging infrastructure. A little bit more than 70% of the homes in Allegheny County are pre-1978. And money. abatement is very expensive, so we try to do interim controls, and usually that's painting over, linoleum. As long as it's intact, generally, and not creating that dust is what we're going for. So most people just can't afford to do that work, and they can't hire somebody either if they don't have the money to do so.
But you think we're getting the message out there as far as awareness goes?
I do. It's been a lot stronger the last couple years, particularly with this grant. The first full year, all we did was education at special events, hanging things around the county, putting notice boards or educational boards out at libraries and clerks' offices. So we're getting more calls, and people are becoming more aware of what lead is. So
Thank you.
thank you.
Any other questions? Did we have a motion?
I have a question, Jamie.
Okay, I thought we did. Yeah.
Where is this lab located?
This lab is in Cattaraugus County. The old lab we used to use has now shut down portions of the lab, but this is $6.50 per sample versus $30 that we were paying with the old lab, so we're saving quite a bit of money.
Any other questions? All in favor? Carried. Okay. And then the next one?
Another MOE for the department requesting a resolution for the Childhood Lead Poisoning Prevention Program. We call it the CLIP contract. We're in year 4 of that contract in the amount of $49,900.
We have a motion to approve this one.
Hanchett will move.
Second.
Helio, second.
And any questions? All in favor?
Aye.
Carried. The next one is an evaluation for
Yes.
speech pathology.
Yep, we would like to bring on a new speech pathologist for the preschool program. Her name is Sarah Young Carlin, and this contract would be in effect from February 1st through August 31st of 2027.
I have a motion for this one.
Rickett Swales.
Second.
Hanchett will second.
Okay, any questions or comments? All in favor?
Aye.
And that's carried. And one more for more laboratory services.
This one is for Rochester Regional Health for our reproductive and sexual health program. This agreement is valid for 12 months, beginning March 1st of 2025 and ending April 30th of 2026. You will see an increase of about 6.3% just from cost of the test and labor going up.
Okay, can we have a motion to accept this?
Root will make that motion.
Helio, second.
Any questions? All in favor?
Aye.
And that one's carried.
Okay. The next MOE is a resolution for our Children and Youth with Special Health Care Needs grant. This is also a 5-year block grant, and I believe it's in year 4. This covers different health and referral and educational services for children from birth up to 21 years of age with different physical and developmental disabilities.
I have a motion to accept this.
Hanchett will move.
Helio, second.
Any questions? All in favor?
Aye.
And that one's carried. Okay.
Another MOE, sorry, there is a lot this month. This one here is to accept and appropriate the Climate and Health Adaptation Initiative monies. This is a new grant that we just received from NYSHO and New York State Department of Health. It's a $5,000 grant. Those monies will mainly be used to purchase tick signs that we will put up in parks and trail entrances, some educational and outreach materials, and more tick kits. Those are always pretty popular in the county.
Okay, can we have a motion to accept this?
Rickett Swales will move that one.
Any questions or comments?
You just like to freak us out with those tick signs.
The state does tick sampling throughout New York State every year, and we see that they've kind of branched out a little bit more. They always go to the Moss Creek area and stuff, but more and more of those ticks every year are coming back either in the nymph stage or the adult stage as being positive carriers, so.
It's my understanding that even with the cold, it does not kill the ticks?
No, there's certain ticks that are more active in the winter, and there are certain ticks that are more active in the, like, summer, springtime.
Nice. All right, any questions or comments? All in favor? Aye. And that's passed. And we
Okay.
have another one?
Yep, another MOE. This one here is for reappropriation of our DEC septic grant that covers Canacadea Creek. There is $2,818 left in that grant that we would like to carry over.
We have a motion.
Kelly will move it.
Second? Right.
Wicked Swales.
Okay, any questions or comments? So will you be getting another grant for this same thing, or is this it?
This is it for the Canacadea Creek. This has ran before I came,
Yeah,
so
it's
almost
been a
6
while,
years. Yep. So it's taken a while to spend out. It's very specific on the details of the septic replacement and who can get it, who's eligible. So there is some monies left there to help probably at least one more person if they apply for it.
Okay, good. All in favor? Aye. And that's carried. And
Okay.
then another one for, another
Very similar.
sewer. Yeah.
The DEC last year expanded this to the Genesee River, again, a very specific area of the Genesee River, mainly between Wellsville and Willing. This is a $100,000 grant, and we'd like to perform a budget adjustment to reappropriate all the money that was not spent from last year, which 0% was spent from last year. Mainly because a lot of those people are on public sewer. So we have to wait till somebody applies that's on private sewer.
All right, can we have a motion for this?
Hanchett will move.
I'll second it.
And any questions?
So, Jamie, are you seeing there's a need for this along that area? If most of the people are on municipal, is there a need for this $100,000 grant?
There is a need for it. It's just a matter of people becoming aware of it and almost kind of waiting till their septic starts to fail and the need for it. For the first 3 or 4 years of the Canacadea Creek, we didn't have any hits on it. And then all of a sudden, we had a lot of people applying for that. So I think it's a matter of education and outreach to those people.
So is there an outreach directly to the people that this would impact, or is it just a general outreach to the general public?
General outreach, it is on our website, but we have not put much out about it otherwise from that, but it is something we should do.
Yeah, I would say if I lived in that area, many people probably don't even think about this or even know about this.
Correct. Usually it's word of mouth that gets out. Yeah.
I'm pretty sure that's what happened with the Canadian one, that's why it took so long to spend the money, that people were not aware of it or didn't think it was going to affect them until
We
all of a
can
sudden.
definitely put something out, definitely on our Facebook pages and at some of our upcoming events that may be near the area, so.
And this would target people that it wouldn't be feasible for them to connect up to the existing public sewer system.
Correct,
Thanks.
correct. Some of those townships have, if you're able to connect and your pre-existing septic fails, you have to connect to the municipality. So these would be ones that aren't able to connect to that, a little farther out away from towns. But it all comes back to the health of the river and that some of these waters are higher in bacteria, coliform, whatever it may be.
Any other questions?
So does some of this grant go towards awareness, making people aware that this grant exists?
No,
No.
this grant is fully for
Just for the-
yeah, so
so-
it'll pay for the contractor, it will pay for up to 50%, up to 50% up to $10,000 per person. So if they have a $20,000 septic, including the contractor fees, and we'll give them $10,000 towards it.
Do you put out, Go
ahead.
You put out any mailings to the general public?
No, for either of these programs, we have not, so.
Any of your
definitely-
other programs, though, that you could include this in, or that maybe there's something else from the county that we could include a a little notice in, or maybe even we might get out a public service announcement.
Yeah, I think because there's no money budgeted in that, definitely what we could do is maybe some flyers, put them around different businesses and stuff that are near that area, and directing them to the website so that they can read through what the qualifications are. We do get a lot of phone calls specifically for the Canacadea Creek area, and most of them aren't eligible for it, don't qualify because they're too far away. It's got to be within 250 feet of the water source.
Is there any other qualifications other than location of their septic systems to the,
No,
creek.
it's just got to be failing, and they have to be within 250 feet of this very specified area of the Genesee River, and that's it.
so this is a pretty small demographic for
Yes.
Allegheny County. I mean, I would guess 30 houses along this route.
There is not many, I want to say 20 to
So,
30 is what we counted.
And the health department has all the files on all the septic systems out there, correct? Since they
Most
have
of
to
them,
be-
if they put them in
since they have to
legally.
be approved by them, I would think I would think it would be a very easy direct mail campaign. You could easily get that demographic to send something directly to the people who are eligible.
Yes, because
Okay,
it is a
thank
small
you.
amount, yes.
Any other questions? Is this a carryover, so if you don't spend it, you can keep carrying it year to
Yes.
year?
Yeah.
Okay. Okay, all right, all in favor? Aye. And that's carried. And then we have a request to fill.
Yes, this is for a nurse practitioner. Excited about that. So this is for hourly rate of $75 in the NISNA bargaining unit, full-time permanent, annual salary of $137.25. 86% of it is being paid for by state funding, 14% by federal grants. This person would oversee all of our clinics, vaccinations, immunizations, family planning is the big one. And then we're hoping to expand and be able to now offer physicals, which they used to do years ago, and DOT physicals. So there's so much more that we can do in that program if we had a full-time NP, so.
Can we have a motion for this?
Patrick will move.
Second?
Haley, second.
If you had any trouble filling the position,
We have in the past under the old salary, but under the new salary, we've been doing advertising and interviewing, and many more people are applying.
good. Okay, all in favor? Aye. Carried.
Thank you.
Thank you, Jamie. All right, now we have Commissioner of Social Services, Don Horan. Welcome, Don. Gary, did you want to ask her your question before we get started?
Hold on, Jamie.
Go ahead,
I just,
Mike.
since Doge has been in the news here so much in the last few weeks, I just wanted to find out if your department's had any warnings coming down about current grants or future grants.
We have heard nothing from any of our state or federal representatives. WIC is the only one that's 100% federal funded, and they've been in contact with their representatives on a weekly basis. But so far, nothing has closed, no caps or stalls on their salaries or grants or anything like that.
Thank you very much.
Thank you.
Thank you, Jamie. All right, Don, your turn.
Good afternoon. Let's see here. Monthly report. Of course, it's been very cold. HEAP and our housing unit has been very, very busy placing people on these cold nights. We have taken care of everybody that has contacted us, and things seem to be going pretty well. So hopefully it warms up soon. So they've been very busy down there. So.
With the warming centers, you place them there at night. How long can they stay? I mean, what do they do during the day? Can they stay there during the day also, or do they?
We made an exception when it was extremely cold, when it was down below 10, that we were not going to have people check out the next day, because part of the Code Blue regulation is that they would check in the night before, and then in the next morning, they would have to check out of the hotel. We kind of run into some things if they don't check out, that if they stay there so long, they can be considered a resident of the hotel or motel. So we have to be very careful of that. So our rule is you check in at night and you check out the next day. So, under Code Blue.
I'm sure there's several people affected by it with this cold.
Yeah, very cold out. Our numbers, other than that, are very consistent, if there's any other questions.
All right, if there's no questions on the month report, we will go to your MOEs.
Okay, the first MOE is to accept and appropriate and request to be able to release the request for a proposal for the youth sports allocations. Last year, we had 3 allocations. One of them was for the infrastructure, what was right around $10,000. That was a one-time allocation, so that was not offered this year. But we still received the youth team sports and the youth sports and education allocations that we would like to get out to the public in the amount of $42,818. Last year, this supported 12 organizations with their youth sports and education.
Can we have a motion?
Healy will move it.
Root will second.
Any questions?
Don, we serve as a pass-through for that money,
Yes, it's a pass-through.
and it goes out to our local communities, is
Yeah.
that correct?
Yeah, 100% goes out to them. So we don't keep anything here for the administration or anything. I just work it in under Social Services Administration for the paperwork.
Thank you.
Is there a maximum amount you can give any one organization?
We tried to divide it up very equally. I worked with that on, with Brian Perkins last year, and the youth board, he worked with that, and they set the rates for that through the youth board. And last year, for each allocation, they gave everybody an equal amount.
Okay.
So,
Yeah, I was reading through the requirements, and, you know, any youth sport team, if you're listening, apply, because
Okay.
it's great to help you out with a lot of different things that you can't usually afford out of your
Right.
fundraisers or whatever. So, all right, everyone, can we have a vote on this? All in favor?
Aye.
Any opposed? And that's carried. And then the venture forth.
This one is, as you know, I have talked about trying to hire a nurse in social services. We thought that we had one, and they went elsewhere. We just need a backup plan now, and we spoke with Venture Forth, Jen and I did, for about a month, and we came up with a rate of $300 for each assessment that they can do. Right now, what we're doing is, if we have an assessment that's due, so we don't miss our deadlines, we will call up another county and they help us out with that. This would just give us a backup plan, and we could use them right now to complete the assessments that are coming due. I know that Tyler and I have talked in the past about maybe once they get their staffing up a little bit more, that they would be able to help out also. So, but we just need something that's more reliable than trying to call somebody up and say, hey, can you do us a favor?
Okay.
Root will make the motion.
Hanchett will second.
Any questions? If you were to work with the Department of Health on the nurse practitioner that they're trying to hire, how would that work? Would your nurse practitioner have time to also do this?
I believe you only need
It's just the assessment.
A nurse
Yeah, it's just a nurse, yeah.
So we would probably have a nurse rather than
Oh, okay.
Right.
Okay.
Yeah, and they could also send me a bill for that too.
Okay.
And then I could claim it under the Medicaid cap. So it would be zero local share, and it would also help out with the nurse's salary.
Right. Okay, good. All in favor?
Aye.
And that's carried. And fill account clerk typist.
Yes, this is a request to fill an account clerk typist. What we would like to do is bring back one of our old employees. We're almost full on all of our positions down there. I'm glad to announce that. But we do have a lot of new people, and bringing back veteran employees that used to do the job to help train works out very well, and they accept what they were making when they left. And then it makes it so that they get firsthand knowledge for the new employee.
Can we have a
Hanchett will
motion?
move.
Second?
Ricketts Swales will second.
Any questions? All in favor?
Aye.
And that's carried. And then one more, a senior investigator
Yep.
support.
Senior Support Investigator, this is due to a retirement. This is right under our child support coordinator position. She oversees all the support investigators in the child support unit.
I have a motion to accept this.
Cricket Swales will move it.
Have a second?
Hatchett will second.
Any questions? All in favor? And that's carried. Thank you, Don, and I'm sure Gary wants to ask you the same question.
Right.
I don't even have to ask it.
No, we have not heard anything. I know that if something does happen, they usually get that out pretty quickly from Office of Temporary Disability and Assistance or the Office of Children and Family Services. We hear something right away.
Are you anticipating any
No,
things that would affect your department?
no.
Thank you.
Yep.
Great.
Can I add one more thing, Jan?
Absolutely.
I would like to just, the department would like to thank LaGras Salon from the donated coat, hat, and mittens drive that they did. They brought a lot of the coats down here, probably 50 of them, that were all youth sizes, and gave them to the department, and we used those for youths that were in need of winter gear. So,
Very nice. Yes.
Thank you.
Thank you, Don. Any unfinished business today? Any new business? Go to the order. I will take a motion to adjourn.
Cricket Swales?
And a second. And we are adjourned. Thank you all.